Welcome to the Lifespan Development Lecture. In this session, we'll explore the physical, psychological, and social changes humans experience throughout their lives and how understanding these stages is critical for providing effective patient care. Humans develop throughout their lives, and as EMTs, it's essential to recognize the physical and psychological changes that occur at various stages. This understanding can influence how we approach patient care and provide the best support. Let's begin with neonates and infants. Neonates are defined as newborns up to 1 month old, while infants range from 1 month to 1 year. These stages are characterized by rapid development and significant changes in physical and physiological functions. At birth, neonates typically weigh between 6 and 8 pounds, with their heads accounting for 25% of their body weight. Growth is remarkable during this stage, with weight tripling by the end of the first year. Neonates undergo a critical transition from fetal to independent circulation. During the first 6 months, they are prone to nasal congestion. Additionally, due to their larger tongues and smaller airways, neonates are at a higher risk of airway obstruction. The nervous system of neonates continues to evolve after birth. Reflexes like the Moro reflex, palmar grasp, rooting reflex, and sucking reflex are key indicators of healthy development. Fontanelles, or soft spots on a baby's head, are spaces between the skull bones that close over time. The posterior fontanelle fuses by 3 months, and the anterior fontanelle typically closes between 9 and 18 months. This slide highlights the fontanelles, the soft spots on an infant's skull where the cranial bones have not yet fused. The anterior fontanelle, located at the top of the head, typically closes between 9 to 18 months of age. The posterior fontanelle, found at the back of the skull, fuses by 3 months of age. These flexible areas allow for brain growth and facilitate the passage through the birth canal. Additionally, the mastoid and sphenoidal fontanelles are visible, contributing to the overall flexibility of the skull during early development. By 2 months, infants begin tracking objects with their eyes. At 6 months, they often sit upright and babble. By 12 months, many infants can walk with minimal assistance. During infancy, the immune system retains some immunity from the mother, and additional antibodies can be passed through breastfeeding. This enhances their ability to fight infections. Psychosocial development begins at birth. Infants interact with their environment, forming the foundation for their future social and emotional growth. Crying is a primary means of communication for infants, signaling distress or needs. The bond they develop with caregivers varies depending on their experiences and interactions. Attachment and bonding are vital to an infant's emotional health. Repeated rejection can lead to anxious avoidant attachment. Older infants often experience separation anxiety, which is a natural developmental stage. Trust versus mistrust is a crucial developmental stage for infants. Meeting their basic needs consistently helps establish trust and lays the groundwork for healthy relationships. Now, let's discuss toddlers and preschoolers. Toddlers are between 1 to 3 years of age, while preschoolers are 3 to 6 years old. At this stage, the cardiovascular system begins to resemble that of an adult. Physical growth continues steadily, and motor skills become more refined. For preschoolers, typical vital signs include a pulse rate of 80 to 140 beats per minute, a respiratory rate of 20 to 25 breaths per minute, and a systolic blood pressure ranging from 80 to 100 millimeters of mercury. This reflects the ongoing development of their cardiovascular and respiratory systems. During this phase, neuromuscular development progresses significantly. However, lung musculature is not fully developed. Weight gain levels off and passive immunity, which was provided by the mother, diminishes. Toilet training typically occurs around 28 months, marking a major milestone in a child's development. Psychosocial changes during this stage are profound. Children begin to learn basic language skills and develop the ability to express themselves. They engage in social activities, start understanding cause and effect, and begin to observe and understand gender differences through role models. Next, we move to school-age children who are between 6 to 12 years old. This stage is characterized by rapid physical and functional maturation. Their bodies continue to grow and strengthen, laying the groundwork for adolescence. During this period, children typically grow about 4 pounds and 2.5 inches each year. Their permanent teeth begin to emerge, and brain activity increases in both hemispheres, supporting more advanced cognitive and motor functions. Psychosocial development also takes significant strides during this phase. Children develop reasoning skills across 3 stages: pre-conventional, where they act to avoid punishment; conventional, where they seek approval from peers and society; and post-conventional, where decisions are guided by their conscience. Self-concept and self-esteem become more defined as they gain independence and experience. Adolescence spans from 12 to 18 years of age. During this time, vital signs stabilize with a pulse rate of 60 to 100 beats per minute, respiratory rate of 12 to 20 breaths per minute, and systolic blood pressure between 90 and 110 millimeters of mercury. This stage includes a significant growth spurt that lasts about 2 to 3 years. Girls typically complete their growth by age 16, while boys finish around age 18. The reproductive system matures, secondary sexual characteristics develop, voices change, menstruation begins for girls, and conditions like acne may emerge. Psychosocial changes in adolescence often lead to conflicts within families. Privacy becomes increasingly important, self-consciousness rises, and teenagers may struggle with forming their own identities as they transition to adulthood. Adolescents also face external pressures. Antisocial behavior and peer influence peak between ages 14 and 16, with risks such as substance use, eating disorders, and unprotected sex. Additionally, this age group is at a higher risk for depression and suicide, underscoring the need for support and guidance. Early adulthood covers ages 19 to 40 years. During this phase, vital signs remain stable with a pulse rate of 60 to 100 beats per minute, respiratory rate of 12 to 20 breaths per minute, and systolic blood pressure between 90 and 120 millimeters of mercury. From ages 19 to 25, the body functions at its peak. Habits solidified during this time can impact long-term health. Psychosocial changes include a focus on careers, relationships, and family life. Early adulthood is often one of the most stable periods of life. Middle adulthood ranges from 41 to 60 years of age. During this stage, vital signs remain consistent with those of early adulthood, including a pulse rate of 60 to 100 beats per minute, a respiratory rate of 12 to 20 breaths per minute, and a systolic blood pressure between 90 and 140 millimeters of mercury. As people age, they become more vulnerable to conditions such as vision and hearing loss, diabetes, hypertension, and weight management issues. Cancer incidence increases, and women typically experience menopause in their late 40s or early 50s. Regular exercise and a healthy diet can help mitigate some effects of aging. Psychosocial changes often center around achieving life goals and readjusting lifestyles as children leave home. Many middle adults balance caring for aging parents and supporting children leaving for college. Finances and career stability become a primary focus during this phase of life. Older adulthood begins at age 61 and encompasses the later stages of life. Life expectancy has increased significantly and is now approximately 78 years in many regions. This period often requires adjustments to the challenges of aging. The cardiovascular system in older adults experiences a decline due to conditions like atherosclerosis. Heart rate and cardiac output decrease, and the vascular system becomes less flexible. Additionally, the production of replacement blood cells and blood volume also decreases. In the respiratory system, older adults experience an increase in airway size but a decrease in alveolar surface area. The natural elasticity of the lungs diminishes, making breathing more labor-intensive and increasing the risk of respiratory complications. Respiratory system changes also include decreased vital capacity and a more rigid chest wall. Reduced cough and gag reflexes increase the risk of aspiration and airway obstruction. Older adults are more susceptible to lung infections and respiratory illnesses. Endocrine system changes include a decrease in insulin production, leading to a slower metabolism. Reproductive system changes also occur, although the extent varies among individuals. In the digestive system, taste sensation and saliva production decrease. Intestinal contractions slow, leading to potential digestive issues. Gallstones become more common, and changes in the anal sphincter may result in fecal incontinence. Renal system function also declines in older adults. Kidney mass decreases by approximately 20%, and blood flow to the kidneys is reduced. This diminishes their ability to clear waste from the body and conserve fluids during times of need. The nervous system in older adults undergoes a gradual decline. Motor and sensory neural networks become slower, and neurons are lost over time. However, there is typically no loss of knowledge or skills, although sleep patterns often change. Brain shrinkage associated with aging creates a void between the brain and the meninges, increasing the risk of subdural hematomas. This structural change can make older adults more susceptible to falls and head injuries. Peripheral nerve sensation diminishes in older adults, leading to increased reaction times and slower reflexes. These changes, along with reduced kinesthetic awareness, contribute to a higher risk of falls and trauma. While most older adults retain their sensory abilities, many require glasses or hearing aids. Visual distortions are common, and hearing loss is 4 times more likely than vision loss, potentially affecting communication and quality of life. Psychosocial changes in older adults vary. While most retain high brain function until about 5 years before death, financial limitations and healthcare access can become significant challenges. About 95% of elderly individuals live at home. More than half of single women over 60 live at or below the poverty line. Older adults face challenges such as isolation, depression, and confronting their own mortality. Support systems are crucial to maintaining their well-being and quality of life.